So, hi everyone, and thanks for joining us. I know that people are popping in. I'm watching a little counter at the bottom of the screen as people coming online. We're doing a presentation today that's been put together fairly quickly because, as we know, circumstances have been changing quite dramatically with the Victorian COVID-19 outbreak and the risk of it spreading to South Australia. And that's prompted some concerns within the NGO sector that's been put to us in regard to how people can protect their clients and their staff and how to manage any cases of COVID-19 outbreak. Over the recent weeks, the sector's been raising questions with us. We thought we'd get the experts in to talk to you about it. So I'm going to start by acknowledging that the land we meet on today is the traditional land of the Kaurna people, or that's where I am, and pay our respects to elders past, present and emerging, and recognise that the land that we meet on, that the Kaurna people of today are as connected to country as they have ever been. I'm going to ask Minister Lensink to welcome us, and then we'll go through our panellists in a moment, who are Nicola Spurrier, who's going to be here with us till about 3:10. She's the Chief Public Health Officer, as you all know, and the Assistant Chief Public Health Officer, or Deputy, I'm not sure which one you are, Chris Lees is here with us. And then we also are very proud to have the Head of SA Pathology with us, Tom Dodd, today, and he's been doing an incredible job, and he can talk to you about testing. And the South Australian Deputy Assistant Police Commissioner, Noel Bamford, will talk to us about restrictions. So I'll over to you, Minister, and I recognise you have to go in a moment, but thank you for being here.
Thanks, Lois, and thank you for the opportunity. Yes, we're all here in this together. I'd like to particularly thank the team from SA Health and SAPOL and SA Pathology for their incredibly important role in this pandemic. Obviously, we've done very well in South Australia, but there's always an ongoing risk, and particularly for the people that we care for, a number of those cohorts are quite vulnerable. So it's very important that we are receiving accurate, current information. So this forum is, I'm sure you'll find it very valuable. Thank you for all of the work that you're doing in this space, and I'm sure you're keen to hear from the experts. So I might stay on just to listen to a bit of it, and I'm sure that you're keen to hear from them. So I'll just leave it at that for now.
Thanks very much, Minister. Appreciate it. It's very busy times for everybody. Now to ask to our very busy Chief Public Health Officer, who was going to have to go shortly, to talk to us for a bit about where we are in South Australia and where we expect to be in the not too distant future, and as well answer some of the questions that have already been sent in.
Thank you so much, Lois, and it's a pleasure to be here. This is a very important issue, and I have been down to Mount Gambier yesterday and was talking to a whole range of stakeholders about aged care, but we absolutely appreciate that everything that is relevant in aged care can be equally relevant in the disability residential area as well. I have a few dot points that Chris Lees has provided for me. So I thought I'll go down and just go through some of the things that he thought you might like to know. So first up is our current situation in South Australia. And I'm sure people are following the media, but we have certainly been very lucky in South Australia and have not had any community transmission that we know about. And we were really feeling very relaxed and very happy to be going back to basically a normal lifestyle. But unfortunately, things didn't work out quite that way. And we now have an extremely real threat across the border in Victoria. And Noel's there online, and SAPOL have done an amazing job protecting our border and stopping people from Victoria crossing into South Australia. But that comes at quite a, it's quite a big task, and it also, we lose out because many of us have friends and family across the border as well. So it's pretty stressful for everybody having that border maintained. And people will appreciate that South Australia exports a lot of goods, and we also need to import things into our community community, and therefore it's not so simple as just saying nobody can get across that border. We do need to let in supplies and freight, and we need to be able to export. And we don't have a port like they do in Victoria, so there is a lot of freight traffic still going back and forwards. So all the time that Victoria have those very high numbers in the community transmission, that poses a very real threat. We've already seen a number of cases now in South Australia, and it has shown us and reminded us about how transmissible that virus is, how easily it is spread from one person to another. The first of those cases didn't give me too much concern because we had been quite happy with how the quarantine had gone, and we knew that we hadn't had any transmission beyond that. But this little cluster that's happening up in the Blair Athol, Kilburn, Prospect area is very, very concerning. I've got a little dot point here from Chris saying outlook for COVID-19 in SA. So I can't predict for you how things are going to pan out. We're trying to do our very best to put ring fence tightly what's happening in the those northern suburbs. But if we look at South Australia as a whole, and I am very lucky to have data and information provided to me by a group of mathematical modelers. And what they do is they take survey data about how South Australians are complying with the 1.5 metre social distancing. And they also use social media such as Google Map use and Facebook usage. And they can give a fairly accurate idea of how much movement we have as South Australians at the moment. They can also estimate how many contacts each one of us would have on a daily basis. And on the basis of that, they can work out, even without taking our current numbers into account, how transmissible the virus is for us. And that shows that actually, as a state, the virus is very readily transmissible. It would get passed on, for one person who has the virus, it will get passed on to more than one other person. And if that happens, we get an exponential growth, and it gives us that potential to have a serious epidemic. So that's the reason why we've recently put in place some restrictions. We've had to reintroduce restrictions that we'd had previously. And people will know from last night that, was it last night or the night before, Noel? I'm losing track of time, that it's now seated dining and drinking, because one of the risks is when you get large groups of people getting a bit relaxed. I know what that's like. It's very pleasant, you know, go out in the evening, and particularly when people are standing up and have that mingling. And so we've put that restriction back into place. Now, we're very aware of the impact on our economy of doing any of these things, because if we reduce the number of patrons in restaurants and hotels and such like, that can make it unviable for those venues to continue. So that's why you probably have heard some talk in the media about whether we put more restrictions in place. And we're looking very, very closely at when we would need to time that. Because one of the other things that's very important is that we keep our public on board. What we do know from the Commonwealth survey data is that there seems to be quite a dichotomy in our community between two groups of people. One group are very scared and want the restrictions back on. They're not feeling safe at the moment. The other group thinks, what on earth is all this nonsense about? We don't have a problem. We just want to go back to normal. So when you've got that in the community, it is very difficult to keep everybody happy. And at the same time, try and do the right thing in terms of public health. So you can see my job's quite hard at the moment. So the other things that we can do, other than those sorts of restrictions to reduce people's number of contacts and sort of do that social engineering, is we can look at our vulnerable communities and try and make sure that we're protecting them as much as possible. And so we've done a lot of work with aged care to look at some of the risks. Now, you'll all be aware that one of the reasons there have been outbreaks in Victoria and that they've spread to other aged care facilities is that many people in these who work in these facilities, they're not nursing staff or even enrolled nurses on reasonably solid salaries and in permanent positions. They are some of the lowest paid people in our employment in Australia, and often a casualised workforce. And that means, of course, that you can't take sick leave easily without having a significant impact on your household income. And that's the reason why people do have multiple jobs, because to be able to support their families, they work in a variety of different sites. So that's absolutely a problem. The other thing in aged care, and it will be the same in disability, is that it's not just the residential care facilities, but people will have home care. So you'll have clients that you're providing home care for. And again, there's a risk in there because you will have workers that go in and out of a large number of people's homes. So if that worker is positive, then that obviously could lead to infection in a large number of people. So there are some challenges. The other thing that we've learned from Victoria is it hasn't been visitors bringing in the disease to the facilities. It's been workers who have infected co-workers. And so people are often very good with the client interaction and wearing masks, and you know, they might be doing all the right thing there. And this is the same in our hospitals. Our doctors and nurses are fabulous when they're treating patients, wearing all that PPE and being very careful. But when you get in the tea room and you're sitting there with your friend Jane or Sarah or David, well, they're your friends, right? And that's when you relax and you have your cup of tea, or you go and have your smoko. And that's the places that people have passed on the infection to each other. So we're very keen to make sure that those places where the staff interact with each other outside of actual work with clients, that people are very aware that they need to keep distance from each other. And we knew that this information came from Tasmania, where they had a big outbreak in Burnie, and they found that in the hospitals that was where the transmission was occurring. So we've been putting in practice policies in our hospitals to make sure that staff are very aware of that. And even now we see nurses having they call it huddles, you know, their handovers. They get quite close together when they're talking to each other. So those are all things that we need to be thinking about. The other thing that's been high on the agenda of things I've been considering is wearing PPE, and whether we should be starting to wear masks in particular. Perhaps we should be starting that earlier rather than later. Maybe it would be good to be socialising that with clients about wearing masks and face shields. And I know that many of you working in the sector probably were doing that early on when we had our first wave, but that may be something that we should be starting to think about again, and we're talking about that in aged care at the moment. So the other thing about facilities is, and Chris has a particular expertise from that environmental and infection control perspective, but that facility, put it this way, people with an intimate knowledge of infection control and are really good at picking where the points of transmission could be, are very few and far between. We have one or two in our hospitals. We've got a couple of people in the health department, but those sort of infection control practitioners are like hen's teeth and very valuable. But if there's any opportunity to have infection control experts visit some facilities and assist those facilities find the areas of weakness, that would also be additionally very helpful. I think because of course in Chris's team they have their food safety team that go out and look at various kitchens across the state and the production of food for vulnerable populations in aged care. And it's almost having that type of lens, but from a COVID perspective. Maybe just one more point on that. When we had our first experience with COVID, most of the experts were talking about droplet spread, and that's why we say you've got to be 1.5 meters away from each other, because if you're not, if you're closer than that, when you're just normally talking, we all produce droplets. And if you're closer than that, you're actually breathing in the other person's droplets. Now, I'm always thinking of these things, and I go running in the morning, and when I'm breathing in the cold morning, I've got a head torch on, I can see exactly where my droplets are going. So when I'm talking to people in an office setting, and often the journalists, they want to come up really close with their microphones, and I'm constantly standing away from them. But it's something that, you know, I've kind of embedded, but I do feel that South Australians are forgetting to do that, and are happy to get up close and personal again. That's it. So that's a droplet transmission. What we probably have under-recognised is fomite transmission, and that's when your saliva or nasal secretions get on your hands, get onto your mouse on your computer. You go away, your lovely PA comes in, uses that, does something for you. She then, you know, picks something out of her teeth, and lo and behold, that virus is spread. And we know with this virus, it can stay viable on hard surfaces for quite a long period of time. Now, I'm looking here, I can see Noel, he's got a beard. I have a particular thing on Zoom meetings because, Noel, you're being very good today, but often men with beards, they have their hands up around their face a lot. And so you can see I become quite obsessive about watching what people do with their hands, where they're putting them around their noses and mouths, and how that then gets transferred to touch points like door handles and the like. So when Chris Leese's infection control goes through Adelaide Oval, she's pointing out all of these touch points need to be cleaned regularly. Everyone coming up the elevator, sanitize your hands as you come up, don't, you know, so you're just trying not to touch things. And of course, when you've got clients and your staff are working with those clients and doing those very intimate care procedures, not only is there that ability for fomite transmission, there's also obviously when people are getting close for that droplet transmission. So those are sort of some of the background. So I'd be saying we are really at a pivotal point in South Australia. It wouldn't take much for us to have community transmission and have more cases in our community. Your clients are vulnerable. I'd be trying to do everything possible within your community to shore up and make it as safe as possible. Now, whether that means there's some way you can reduce staff working across facilities, I think you should be looking at wearing masks and face shields and starting to consider in what situations you will do that now and the like. There was another dot point here about proactive testing, and I could see that you don't want to use the term surveillance. I would agree. It's not really surveillance anyway. You basically want to be testing anybody with any respiratory symptoms and making sure that we can do that promptly. And Tom's the expert. Tom has been sticking his little probe up so many noses across the state. There's nowhere that Tom has not been, I think. And so we have been putting in, or Tom's been putting in more pop-ups and making it more accessible as we've gone on in time. But if we start doing a lot of testing of people who don't have any symptoms, asymptomatic testing or that sort of surveillance testing, then we will be wasting our precious resource. So at the moment, the only people we would want to be testing in the disability sector are people with symptoms, either the clients or the staff. I think that would be fair to say, Tom? Yes, okay. So then the last dot point is planning for responding to cases. So we need a really good plan whereby if somebody comes back COVID positive, we can make sure that they are in a facility where they have treatment, but also that there's no chance that there could be breaches in PPE with staff caring for them, and then the disease is transferred onto other clients, particularly in the residential facility. So for the aged care sector, we're the only state where, when we first did our plan, we said we would retrieve the elderly person and have them go to hospital. Not because they clinically might have needed it, but because we didn't want that infection to be a source of spread to other residents. So I know that a plan has been written for the disability sector, although I think I'm correct on that. And I haven't actually seen the final version of that, but one of the things we've been doing in aged care is exercising our plan, which means we have mock cases. And we had a practice of the aged care recently. The team got the call to residents in a facility. They went out there, their rapid response team went out there to deal with it. And of course, what happened? The nursing home said, "Oh, where's evidence of your flu vaccine?" and wouldn't let them in. So that's the first thing we've got to make sure is our rapid response team all have documentation of their flu vaccine. So it's all very well and good having a plan on paper, but we've got to be practicing it, and we need to be doing it now. That's kind of our responsibility, but it's also, you know, I invite you to think about how your facilities might be able to practice their plans and their business continuity plans. So at the moment, if you've got residential care facilities where the rostering's the way it was a year ago, and you haven't split teams into pods that only interact with those people, then this is the time to do it, because you've got to think of your, through any sort of continuity planning if a situation arises, because it's too late doing it when you get your first case. So that's probably what I wanted to talk about. I'm sorry it's a bit doom and gloom, and it wasn't the rosy sunny place that we thought South Australia would be at the moment. It is, we're on high alert.
Thanks so much, Nicola. I've got a few questions in the chat, and I know you've got a few minutes left, if that's all right.
Sure.
That's really useful information. Also so there's people from across the non-government sector on today's webinar, and we've also got people from our own Department of Human Services. In amongst those people, we have people who are involved in translating and other easy English. So we're being asked, one of the questions is, do we need to do more to distribute easy read and translated COVID material to the public, or are there other things that can be done to assist the understanding in the Blair Athol Kilburn Prospect cluster that we could assist with?
Oh, we would be delighted if there was some other leaders that you know within your sector who could help distribute this information, because one of the things that it became rather obvious with one particular case was that they didn't know where to get a COVID test. Now, Tom, I know you just cannot believe this is possible, right? That you just Google COVID testing SA and it comes up with a list, but they didn't have that understanding and instead thought that it would be going to a GP or a pharmacy, because they didn't understand, and they also thought that it was going to cost them. So we did a little social media picture and a post. I don't know, is Chelsea on? And then that was distributed. But probably if Chelsea's not on, she's the director of our comms team, that she would probably be best to answer that one.
Thanks, we'll take that up. We've also got a question here, and I think you've sort of answered it, but there's a lot of people within the group homes disability sector, so we're providing disability services into group homes, which are between 2 and 5 people in a house, asking whether or not if somebody gets COVID in one of the houses, whether they will also be retrieved to hospital like the aged care sector.
Yeah, so if we left that person in that home, there would be a very, very high chance that it would be transmitted to the other people living there, because even when you've got separate bathrooms in a big home, it is still easily transmitted. So this, I would say, would be a real risky situation, and we wouldn't just have one case, we would have 5 people positive. And you might think, well, that's sort of quarantining because those people might, you know, you might be able to keep them there for the 2 weeks and not let them leave. But we don't want 5 people positive. We only want 1 person positive. So yes, absolutely, that would be the situation. Now, we do have alternatives to hospital. So we're using our hotels not just to quarantine returning South Australian residents, but we're using it as a Medi hotel because you might have people in your sector that physically are fine and don't have any vulnerabilities, and in fact don't need to go into a hospital because clinically they're okay. But we might suggest, for example, using one of our Medi hotels. Now that could be quite challenging for somebody who, depending on their level of disability. So we would have to think through how we would do that really safely. We've got a fantastic group of nursing staff led by Jenny Hurley. We have mental health clinicians, and the hotel facilities have pulled out all the stops to make it a really relaxing and enjoyable experience having 2 weeks in their hotel. In fact, when I see the video, I'm wondering if Chris McGowan and I thought if we popped our foot across the border into Victoria, maybe we could get a stint in the Pullman. But anyway. But yeah, so we do have some different options, and when we had some cases earlier, we also use the it's the what is it? It's not a caravan, or it's a sort of caravan and camping park up up near Flinders. It's a recreation park. They've got some extremely nice units, an outdoor area, which was a very successful way of having a case looked after, and then they had the hospital supporting them. So we do have a few different options.
Fantastic, thank you. And part of that, one of those questions was, would a carer go with them? But from what you've just said, that would be a case-by-case, I assume.
Absolutely, it would be a case-by-case basis, because of course that would mean that the carer was at high risk as well. And we wouldn't want somebody who had high risk, you know, had vulnerabilities in terms of chronic disease or comorbidities to be put in that situation.
Thank you. Getting a lot of questions here about whether or not, whether or not there'll be use, you recommend use of face masks by workers generally as a matter of precaution, face mask in transporting clients. Are you suggesting that we should be considering face masks as a matter of course now?
Yeah, so I'm just giving you the heads up because we've had initial conversations today thinking about the aged care sector as the first in the first instance, because if we can't guarantee that the workers only work in one site, that would be an additional layer of risk mitigation. Now, it would just be for when you are working closely with a client, and there are very, as you know, I'm not telling you guys anything because you're involved with providing that level of intimate care for people to support them in their chores of daily living, but it would be for in the aged care for when they're having those patient the client interactions. Yeah, but I thought it's worth raising it with you guys because you might have some thoughts about that as well that you could feed back to us, and in fact you may have already been doing it.
Thank you. And one of the questions that I think you've just answered was, are you going to stipulate no work across multiple sites in aged and disability? But you say you're working through that at the moment.
Yeah, look, it's a really difficult problem. It's a bit of a wicked problem. We know what we have to do, but it's going to change the industry. And normally when you're going to change something that much, well, you take at least a year and do a lot of stakeholder consultation, but we don't have time to do that. And we're trying to save lives. We do not want to be in the situation that Victoria's in with those deaths every day being reported.
And a regional question for you now. There's obviously thin workforce in the country areas. Is there any recommendation of minimising travel from country to city if we have an outbreak?
Look, this might be a good one to pass over to the Assistant Commissioner, over to Noel. Do you want to have a quick couple of minutes, Noel?
Well, I'll give that one to Noel when it gets to him. How about that? Yeah. And because I know you have to go shortly, so I'll give you just a couple more questions if you don't mind. One that we've been asked is, should employers and employees at the moment be looking at working to a 4 square metre space and rather than 2 square metres? And should people who've, you know, we had everybody go home and then come back to the office, should we be going home again? What are you saying?
We haven't put out any messaging at the moment about working from home, but on the flip side, we've never told people they should be getting back to the office. So I think people should be working from home when they're able to, and it's possible to do that in conversation with their employer. And in many cases, people can be more industrious at home than they are in the office setting. We have continued all of our meetings to have physical distancing, and the use of the Zoom meetings has been fantastic, and it really does reduce the number of close contacts that you will have during the day. So the more space, the better. The further you can be away from each other, the better. The more you wash your hands, the more you clean surfaces, the better. If things can be done outside and it's better ventilated, so be it. That is much better. So in close, confined quarters like abattoirs, that is the perfect place to spread COVID, and that's why there have been those outbreaks in abattoirs. People are working very, very closely together. It's poorly ventilated, it's hot, it's humid, and also you've got these meat juices that are, you know, moving around in the atmosphere, and it sounds like the COVID likes to attach itself to those. So that's why we've had those, you know, that along with we've all forgotten about the cruise ships, but along with cruise ships, it's the perfect environment. So the further you can get away from something that's like an abattoir, a cruise ship, or no, I will add a nightclub, the better.
Okay. Thank you very much. So just one more question, I think, before we let you go, Nicola, is I'm just choosing amongst the so many I've got here, actually, which is for social programs. Now, you talked before about separating out staff that are working in residential facilities, but we also obviously have right across the non-government sector people running social programs or running peer support conversations or play groups, those sorts of things. Should staff be separated into working with the same group each week so that you are not working across different groups? That's one of the questions.
Yeah, that's an excellent idea. If you can do it, then do it. It's like with our giving information to the sporting clubs and community sport. So they were told, when you've got normally, like my son plays basketball, he might play, there's 12 teams and they do a round robin. So what we've asked those sporting teams is they reduce the number of fixtures that they have. They only play 4 teams, for example, because it just reduces the number of contacts that everybody has. So if there's some way that you just have the same person supporting the same group, then it means that when our contact tracers have to, you know, kind of follow people up, it's a much smaller number of people that it's passed on to.
Fantastic. Thank you very much. And thank you very much, Nicola and Chris, for all the work you're doing. We are all very grateful as citizens and as community sector, and for the information flow between ourselves and your officers has been really helpful. We'll let you go. We know you
No, that's all good. Thank you. I'll just say one thing, that this space is changing all the time, all right? It is a pandemic. What I say one day, I might have to change the next. So it keeps us on our toes and it's not boring.
And despite the fact I knew you were online, I touched my face twice. So we're all going to go back to where we were. I was much better at it a few weeks ago, so we just have
right. Well, I'm hoping that you all have this on your desk.
Oh, yes.
Yep. Yep. Excellent. Right. The Aqueum gel, we can't leave home without it.
I used it. That wasn't necessarily. But anyway. Right. Thank you very much, Nicola and Chris. So,
thanks. And
we'll see you later. Now I'm going to pop over now to talk to Tom Dodd, who is the head of SA Pathology, and ask Tom to talk about, you've had a very big day, Tom, I gather. Today is the biggest testing day. Perhaps you can tell us about that, about how we're running testings and some just general information about what's going on at the moment. Over to you.
Sure. Thank you, Lois, and good afternoon to everyone. Yes, so obviously, Nicola's set the scene. Quite a lot of things have happened in the last 2 or so weeks, really responding in a way to the situation in Victoria. Up till then, we've had a very stable testing arrangements in place, which has stood South Australia very well over the last few months. But obviously things have been stepped up significantly with the border closures. In part, we've had teams of nurses working very nicely with the SAPOL at the borders. So people have been having swabs actually taken right at the border. As many of you be aware that travellers coming into South Australia, initially essential travellers and others crossing the border were having swabs done on days 1 and 12. So that increased the number of people requiring to have swabs. And that, in fact, has proved very effective in identifying several cases that we've seen here in South Australia in the last few weeks. Clearly, the need for swabs in general have increased significantly. And so, as everyone would probably be aware, we've just opened another very large drive-through collection centre at Victoria Park. And so that's been up and running for the last couple of days. I think they saw 950 people through there on day one. So that's added significant capacity. There's another similar drive-through open today down at Aldinga. And I understand the Lyell McEwin Hospital has also got a drive-through there. So in many ways, that's actually, they're probably the best options for people to easily access swabbing. Many people have been going into the big teaching hospitals to get their swabs taken, and that's fine. But in terms of just managing the risk of spread, if you can just stay in a vehicle and drive through and get the swab taken, that's by far the most efficient and easiest way. The other thing that we've done really now is make that a little more straightforward, so you don't need to have a pre-arranged booking time or even a request form from a GP to come to any of those drive-throughs. Up till then, we really have thought it was probably best to have a sort of a medical consult in a way, just to provide some advice. But obviously the number of people needing to present for swabs now has increased significantly. So those changes, I think, will make it much more straightforward for people to get swabs. As Nicola indicated, it's quite interesting. I've been out myself actually taking swabs from a number of people, particularly in the northern suburbs in the last week or so, and just chatting to people. People's awareness of how to go about sourcing a swab varies a lot, and so everyone just can pass the information through to their broader community about how you can access swabs through the hospitals, but particularly through the drive-throughs. And the other thing I would emphasise, particularly for some of the people online, is we also have a big domiciliary service. So SA pathology nurses and also some of the private labs also have domiciliary services. So nurses can come out to people's homes or their residential locations and take swabs from people on site. And I think that's a very efficient and effective way for people to easily access swabs. So in terms of numbers, about 3 weeks ago, we were maybe doing a little over 2,000 swabs a day, and the laboratory thought it was very busy. Well, we're on the brink of cutting through 5,000 a day. So the lab is working very, very hard, but still maintaining very good turnaround time. So the turnaround time within the laboratories has still remained in that sort of 14 to 17 hour range. So I've been incredibly proud of how well everyone's done in that way. We try to turn around results as quickly as possible, and I know it's always a little anxiety producing when everyone's waiting to get their test results. Please be patient with us. We do have what is a fairly effective SMS system. It works well, but the trick is we've got to get the patient's details right and their mobile phone numbers right. And one of the catches we've sort of figured out is that if we get anything wrong on either the spelling of someone's name or the mobile phone number not being perfectly correct, and 10-digit numbers can be a problem sometimes, that system fails. So the other thing I would just suggest is to also add, if possible, the name of the patient's GP. And that's another good way of getting the results back. So that we'll also send a sort of complimentary copy of the result of the patient's swab to their GP. So if you're not getting that negative SMS message within a sort of 2 to 3 days after the swab, then you can go back via the GP. The other thing we are doing is putting on a larger team of staff at SA Pathology to ring through negative results where we think there's an issue with the, for some reason, the result wouldn't have gone out by the SMS system. So we're looking at ways of really making it very efficient and effective to get out the negative results to as many people as we possibly can, because I know everyone's hanging on their results. And obviously for some of the folks online in the disability sector, it's obviously really important that we get those results back, because you're having to manage staff and manage your clients. We try to expedite those tests as best we're able. Really, once the swab is in the lab though, the turnaround time can't really change. It takes that period of time for the instruments to go about their processing cycle, but we're always happy to hear about anyone who needs an expedited test, and I've certainly facilitated that on a number of cases for the disability sector. What happens from here, I think, will depend on a lot about whether we do see any more community transmission. SA Pathology does have the capacity to do more testing. We have preparations for a rapid response testing if there were to be a cluster in any sort of facility. We'll be able to come in and do extensive testing, and so we're quite confident we'll be able to address that very quickly. Make use of rapid testing as well in that way. The other thing we've been doing is putting up a couple more of these pop-up testing spots where there's perhaps a little less ready access to testing. So we put up a site down at Port Adelaide about 10 days ago, and it went from the first morning of not too many to traffic jams. I'm sorry, Assistant Commissioner, causing some traffic issues for you folks, but it just goes to show that we need to make access to swabbing as readily available as possible to people across all areas of the whole of the state, really. So it's been hectic, but I think we've made some big strides forward in making access far more accessible. And so I'm confident this will just continue on as we need. Hopefully Victoria's tight measures that have come into place in the last 24 hours will see their numbers start to decline, and we've just got to hold the line here and manage our little cluster in the north and deal with anything else, and we get back to some sense of normality again sooner rather than later. But if things go the other way, I think we have the capacity to deal with it rapidly.
Thanks so much, Tom. I've got a few questions for you as well that are coming in on the question and answer, whatever that is, pop-up.
Yeah.
But just before I do, I've had a few people recently kind of say that they're scared of the test, or that the test feels like someone's tickling your brain, or all sorts of things. Can you just talk us through what the test is?
Yeah, so the tests are all taken by trained staff. That's the first thing. The vast majority are experienced nurses taking the tests, taking the swab. So it's effectively a swab from the back of your throat. It's actually quite a soft little brush on the end of a plastic stick. So the swab's taken first from the throat, and then there's a swab taken from one of the nostrils. As you can see, for those who can see me online, I'm sitting at home recovering from a cold. I've had a swab in the last couple of days. It's not painful, but it is a slightly weird feeling, slightly discomfort, I suppose, but it's all over in the space of a couple of seconds. And so people have just got to prepare for a weird sensation for two seconds, and then it's all over. I was out swabbing a family over the weekend, and it's quite interesting. Everyone did well and the baby did well, but the 3-year-old wasn't having a bar of it, as you'd expect. So I think it's understandable that people are anxious about anything like that, but the key messaging is it's not actually painful and it's very quick.
Thank you. We've got a couple of questions. It's still being said, people are hearing in regional areas that they still have to get a GP referral to get a test. Is that right?
So look, the arrangements vary somewhat from one location to another. And so in some of the regional centres, there might be an arrangement with the local hospital for people to get a GP referral. But I'm sure at the moment, if anyone presents to their local COVID clinic at their hospital, they'll be able to get a swab arranged without any difficulty. And certainly now in Metro Adelaide, it's very straightforward to come to any of the drive-throughs, both public and private, and get a swab done without any prior paperwork.
And okay, thank you for that. So I think the message there is go to the regional hospital, and if you hear, if that doesn't work, please let us know and we'll pass that information on. So then we're being asked, is there, are people who are tested clearly told to isolate at home until their results are known?
Yeah, so that's really important. So as Nicola emphasised, the vast majority of people that are coming for swabs are symptomatic. So even if you even mildly symptomatic, it's very important that people are swabbed, and they really need to isolate until they have that result back. If you have a positive result, you'll be contacted very quickly. And as I mentioned before, we're doing our utmost to get the negative results out as fast as possible. The only people that really don't need to isolate are those who are in the asymptomatic essential traveller group, such as truck drivers. So there are two groups of people really, the truck drivers and the cross-border community. And both of those groups are being asked to have a swab at the moment once a week. They're otherwise well, and this is a precautionary measure. So for those two groups, really, they need to have their swab, but they don't need to isolate. Essentially, for everyone else, if you have a swab, you really need to isolate until you have your result. And for those people who are in sort of quarantine because they've come into South Australia and having a day 1 and a day 12 swab, they're having to quarantine for 14 days anyway.
Thank you very much. I have some other questions, but we're going to leave them there and we might publish some answers, because I know that people want to hear from the Assistant Commissioner about restrictions and what's going on at the moment. I want to say thank you very much, Tom. Thank you particularly for the incredible support you've given the sector in terms of expediting tests where we have people in residential facilities. If you have that situation, please call our COVID team here at DHS and we will have the conversation. We recognise you can only do what you can do within the lab, but we appreciate you being able to get us some results a bit earlier so that we can manage the fact that people are living in congregate settings. So we're really grateful for that. And it does appear that SA Pathology has become a state treasure in recent times. So well done, you guys. It's really fantastic. So thank you.
Thank you very much.
I'm now going to hand over to Assistant Commissioner Noel Bamford, who's going to talk to us about where we're at with restrictions, what's changing, what's coming, what's going with border crossings, and all things SAPOL. Over to you, Assistant Commissioner.
Thanks, Lois. It's a fairly big topic. Where do I start? Perhaps if I talk about a little bit about why we've put the restrictions in place in the first place. Clearly, the police are here to support health in the response to this pandemic, and it was very clear very early that we needed to do two things. One was limit the number of people coming into South Australia to prevent more disease coming in, and because back in March we actually had the disease in the state, we needed to slow people moving around the state again to stop that spread. So a whole raft of restrictions came in a very quick over a small period of time, and they were really effective. And as everybody knows, we got on top of it very quickly, and the infection essentially disappeared from South Australia. Of course, restrictions come with a huge cost to the economy, to people's lives, to people's working employment, and we did what we could to lift as quickly as we could. But because there was obvious disease in other states, the strategy that we've applied is that we've increased the restrictions on our borders in order to lift the restrictions within South Australia. And we were going extremely well with that until, unfortunately for the Victorians, it pretty much got out and ran away over there. So as a consequence, we've continued to add more restrictions to our borders, increase the number of police, especially in the Victorian border. We've got over 100 ADF personnel assisting us down there now, and we currently have about 22 fixed sites along the border where we're stopping everybody that comes in. And I'm sure everybody knows that on the 29th of last month, we essentially stopped anybody apart from essential travellers coming in from Victoria. That's had a really significant impact on the number of crossings a day, but there's still a lot of vehicles that come across. Victoria is the main supply chain to South Australia and Western Australia as far as trucks go. And therefore we've still got a lot coming through, excuse me. But the other restrictions we have in place, and Tom mentioned some of those about truckies quarantining in their cabins when they're not at work. That's anybody that's not a South Australian, or the more recent one of a 7-day rolling test, are all there to protect the community from any further influx of the disease. I'll just have a little bit of water, I think. So they all go hand in hand, and it's a significant resource burden on the police, but it's one that we willingly do. To give you an idea, we've checked since March, we've checked about 23,000 premises to make sure that they're complying with all the restrictions that they have to, and we've checked on 50,000 people. We roughly 500 people a day we welfare check. These are people who are in quarantine, generally not a positive case, just doing their 14 days. And we have a really good compliance rate. It's between 90 and 95%, which is significantly higher than some of the eastern states. So we're really pleased the fact that the communities come along with us, that they're listening to what we're asking them to do, and they're responding well when we go to their house. So overall, things are from a policing perspective going well. In the second week of June, we decided we'd go to an electronic application process for people who wanted to come into South Australia. That went live on the 1st of July, and I can tell you that over 100,000 people have lodged applications since that time. We've processed them all, and we got overwhelmed initially, but I'm very pleased to say that we're currently basically in real time. So we've got less than 100 applications on our system as I speak. That's also allowing us to more closely monitor who's coming into South Australia, and gives us much better, more robust data when we're going to check on people's welfare to make sure that they are quarantining and they haven't come down with the symptoms and they have had their tests that they're required to do. So there's a whole raft of things in place there. We meet very regularly, the Commissioner and I and the health representatives meet several times a week to discuss what's going on as far as cases go. Do we need to change our restrictions? Do we need to, or can we lift, or do we need to put more on? But we're really mindful about every time we put restrictions on, one, it restricts people's movements, but two, it starts to impact on the economy and people's jobs. So every time we do something, we have quite a debate over whether it's the right thing to do. On Wednesday morning at midnight, we reintroduced the requirement to sit down while you're consuming alcohol and food. And the reason for that was we're really worried about the people in licensed premises who, after they've had a couple of drinks, they start to forget their social distancing, and we're concerned that if it does get into South Australia, it'll go like wildfire, so to speak. So they're just little tweaks that we're doing, but we're trying to avoid going back to where we were before, and nobody wants to end up like Victoria. So we're hoping that generally the community will see what's going on over the border, and there'll be a lot of self-compliance, because we don't want people to forget and just start to behave like we always used to, because that would be quite dangerous. That's pretty much the spiel that I have, so I'm happy to take questions.
That's awesome. And we've got 2 minutes left, so I have one question for you so far on the chat, and a couple from, oh no, I have more than one. I scrolled down. Can I ask, first of all, if people know that someone isn't isolating, are they obligated to report them, or should they report them, and where to?
Yeah, they're not obligated, but we would be very happy to receive a phone call, and they can ring us on the police assistance number 131444, or excuse me, Crime Stoppers 1800 333 000. But the 131444 number will work fine, and they'll take the details, and we'll go around and knock on the person's door and see where they are and why they weren't home.
Thank you very much. And are you noticing a difference with the compliance between different demographics, young people, other people from other cultures? Is there a difference in the way people are complying based on age or other demographics?
Yeah, I think it's fair to say, since we've really nailed down the border between us and Victoria, it's not a secret that we've been arresting people. As you can see, our attitude's pretty low tolerance. So if we find people are just blatantly not going to comply, we're happy to start off with a $1,000 fine and rapidly work up to we'll arrest you and put you before the courts. It was only about 2 weeks ago that we asked the Attorney General to add a term of imprisonment to a breach of our directions, and that's happened. So it's a maximum of 2 years imprisonment if it's a very serious breach. So we don't like to come in heavy-handed, but there are some members of the community that decide that it doesn't apply to them, and very much it has to, otherwise nobody gets the protection that we're looking for.
Thank you. And it may well be an argument for more education, and as people were talking about earlier, different language information, etc. I thank you very much, Assistant Commissioner. I note that it's now called vertical drinking. There's a whole new term out there in the world that I'd never heard. I feel that must lead to a revise of an old joke, which is why don't people drink standing up, and that it might lead to dancing. But we do really appreciate everything that the police are doing as well, and we recognise that it's pretty heavy times. And as you say, you don't like arresting people for things that are quite an unusual offence these days. But we know that there's a lot of effort being put in to try to stop the spread of what is essentially a worldwide pandemic. So thank you for joining us. Thank you to everybody who's joined us online. We will try to answer those questions that we haven't answered published on our website. I'm very grateful to a really impressive line of panellists to come along and talk to us today, and we will try to keep you updated. Stay in touch with our COVID team, and we'll try to keep the information flowing and stay ahead of this thing. Thanks everyone. Appreciate your time.
Thanks, Lois.
Bye.
Thank you.